Welcome to another episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome everybody again to another episode of our show, bringing you not one, but two fascinating guests today, helping to create a better tomorrow. And today we're back again with our friends at NTT, or otherwise known as the Nippon Telegraph and Telephone Corporation. Going to be having a discussion at the fascinating epicenter of technology, innovation, sustainability, and healthcare. So a lot of great topics today. We are first joined by Dr. Heather Haugen today. She's Vice President of Healthcare Advisory and Innovation for the Americas at NTT Limited. Dr. Haugen has deep experience in health information technology, a passion for research and the application of outcomes, the challenges that ultimately currently exist in healthcare arena today. She has more than 20 years of experience in both the academic and private sectors, including previously serving as roles as Chief Science Officer for Atos and their Digital Health Solutions Division, also Managing Director of the Breakaway Group, part of the Xerox Company, ultimately leading to a unique mix of experiences involved in research, outcomes, and leading and developing top-performing teams. Dr. Haugen's research and methodology is also published in her book entitled Beyond Implementation, Prescription for the Adoption of Healthcare Technology. Dr. Haugen also holds a faculty position at the University of Colorado, Denver Anschutz Medical Center as the Director of Health Information Technology, where she actively mentors doctoral students and teaches courses, has her bachelor's in biological sciences at the University of Denver, her master's in human nutrition from Colorado State University, and her Ph.D. in clinical science, health information technology from the University of Colorado School of Medicine. In addition to Dr. Haugen, we're also being joined today by Vito Mabrucco, who is the head of global marketing at NTT. Previously, he served as Senior Vice President of Worldwide Consulting at IDC, the global provider of market intelligence advisory services and events for IT, telecom, and consumer tech markets, where he was responsible for Canada, Japan, and the Asia-Pacific region, and has really deep insight into global information and communication technology industries with a focus on the value of technology, strategic business models, key industry segments, and global market trends and directions. He's a 30-year veteran of the information and communication industry, has held senior management positions at technology companies including IBM, Tandon, Compaq, Dell, and Cisco. And Vito is a graduate of the University of Waterloo. He is on the board of Information Technology Association of Canada and a member of the campaign committee for the United Way. Two really great guests, Dr. Heather Haugen, Vito Mabrucco, thank you so much for taking the time to come on the show today.
Thank you.
Absolutely.
Appreciate it.
Yeah, it's an exciting set of themes that we're going to be getting into. I'd love initially, though, to hand you both the mic for a few minutes each, just to talk a little bit more about, I gave sort of the summary, but a little bit about how you both arrived at, what is in essence, one of the largest telecommunication companies in the world. Obviously, Vito coming from the IT side, Heather, you from healthcare. Talk a little bit more, if you would, for a few minutes, both about your journeys and how you got to NTT, if you would.
Okay, I guess I could start with just saying that my industry experience is quite broad, as you've seen. And when NTT, maybe 3.5 years ago, we really decided that we had to drive a stronger presence in the global markets. And I was brought in to lead the global marketing team and kind of herd all the cats, where we have all of these great solutions and technologies and people, and kind of really zero in on what is our core message, what do we stand for, what's our business model. And it's been a real journey, because it's one of the largest unknown IT companies in the world. We're 113 billion in revenue, 320,000 employees. Over 40% of them are overseas, meaning outside of Japan. So we have a tremendous opportunity, but more importantly, we have a tremendous obligation to bring some of the core technologies that we've been innovating in our labs and through our R&D to really help and drive our core purpose when we talk about ourselves is contributing to society through our business operations. And that's not just a set of words that we came up with, when everyone started talking about, multi-stakeholder capitalism. It's really embedded in our culture from 150 years ago, which was how NTT was started as a company in Japan. So anyway, I'll keep that short, but just to say I'm here because I believe in the purpose of contributing to society through technology. And after 30 years, I've seen the good and the bad that it can do. So hopefully we're going to do more good than bad.
Outstanding. Heather?
Yeah, absolutely. I think I would start by saying NTT is known for this, infrastructure and backbone that we provide in the industry. But one of the reasons why I joined NTT was to bring that industry expertise. And so I know that when we implement technology in healthcare, we have to be thinking about the patient. We have to be thinking about the provider experience, the nurse experience, and really ensuring that those pieces work together. And so, you can be the greatest infrastructure company in the world, and you really want to tie that back into what matters the most in the industry. And you'll hear me talk about this, but I'm really passionate about, especially about this patient care process and the quality of care that we provide, and really ensuring that patients understand what they can do to better navigate the healthcare processes. And I knew the leaders in the Americas, and I knew what they wanted to go do to bring these two things together. And I was excited about that mission.
Outstanding. Outstanding. We're going to be talking in a little bit about the NTT report entitled Innovating for a Sustainable Future. But, when you open up this report, the first thing that hits you is it starts off with this quote from Nobel laureate economist Milton Friedman. It basically says, the only social responsibility of business is to increase its profits. And then NTT comes in and says, no, we have to do a little more than this. We have pandemics, we have economic uncertainty, environmental issues. The real mission of a business is to enrich corporate stakeholders, but also contribute to health and well-being of people and our planet. And then it goes a little into the United Nations Sustainable Development Goals and so forth. Take a couple minutes, once again, each of you, just to talk a little bit about what sustainable development means to both of you, again, from the different lenses that your experiences come with, again, from Heather from healthcare, Vito from IT and the marketing side of things, if you would.
Yeah, maybe I'll start this time. Is that okay, Vito?
Absolutely.
Yeah, perfect. So as we begin to think about digital transformation in healthcare, we have electronic health records now. We're digitizing a lot of our records. I think we have the ability to also keep sustainability in our mind at the same time that we are going after these other efforts. And so ensuring that those pieces come together, that the effort that we spend, resources that we spend in the area of digital transformation, we can be really thoughtful about sustainability. And to me, it is, the big picture of sustainability, which is healthier communities, healthier populations, and goes beyond sort of our facilities and buildings, but really starts to look at how we ensure that the well-being of our communities is top of mind as we're building out this digital transformation. So I think about those two things when I think about sustainability. And to be honest with you, it can be a tad overwhelming, right? To think about all the ways that sustainability can impact our work. And so we just have to be very strategic in how we begin that work and how we embed it in our processes.
Yeah, and from our point of view, sustainability is a big word, right? You hear it all the time, and it's thrown around a lot, and it starts to become one of those words that you say, well, what is it? What do you really mean? That's just a corporate marketing statement. And what the reality is here is that, most companies would say, well, we have a chief sustainability officer, go talk to them. They'll tell you what we think. we don't have a chief sustainability officer because our chief sustainability officer is our CEO. He really is totally and completely committed to the concept of sustainability, because when you think about Japan, they actually have that embedded in their culture. If you've ever been there, or if you've ever seen kind of how they live and how their culture lives, it cherishes sustainability from the very beginning. And so when we started talking about that, all we really had to figure out is, how do we explain what our goals are in sustainability? And we start with the idea that it's about humans. It's about connecting humans to humans, humans to nature, nature to technology. And the newest thing about sustainability is connecting to technology. So when we looked at that, we said, well, what do we need to do in our labs to ensure that when we create a sustainable society, we're improving in the contribution through our technologies, and our technologies are not making it worse, like we've seen in some cases. And so the object of this study and of this idea of innovation for a sustainable future was to really try to communicate and really explain how our technologies are founded in the idea of creating a sustainable world, whether it's through people and communities, whether it's through the environment or economic prosperity. So it was a big task, and we're not done yet by any means. But the study really gave us that first kind of a stepping stone into what are the best practices that sustainable leaders have, and how does technology support that? And that's really what we wanted to understand.
And the report, which, and we'll put a link to it in the bio of the show, once again, Innovating for a Sustainable Future, extremely comprehensive. You talk to over 500 companies, 7 industries, 8 world markets, so clearly I'm quite global with this, and discussing everything from how firms are, as you were mentioning, dealing with this word, it's a big word, sustainability, how technology is coming into play, whether it's digital innovation and so forth, to achieve these trickle downs of social, environmental, and then obviously economic goals. And there was a lot of top line learnings here in terms of, that companies found sustainability was, hey, it was good for profits. It also, digital innovation was a cool part of this, and hey, NTT is a big digital innovator, and then also throw Heather in there as well with this one. Health and well-being is an important part of sustainability as well. Once again, please tag team on this one any way you would, but just talk us through a little bit. We'll talk about some of the best practices in a little bit, but what are some of the key things that stood out to you as you really digested this substantial amount of information from these global players?
Well, maybe Heather, I'll start referring to the research report, and there is a big component there on health and well-being, which maybe you can pick up on. So the things that came through is, to no surprise, more and more companies realize that sustainability is an imperative in terms of their board level priorities, and so we just validated that. What we found interesting was that the US and Europe had a much higher expectation of board level priority for sustainability than Asia Pacific. Now, we didn't include Japan in the study, and I think that would have changed the numbers. But even in the US, 72% of the leaders said that it's a board level priority. So that's fine. We get that. Everyone understands that. But what stood out for me was that the leaders do what normal leaders do: vision, strategy, communication, structure, budget, all of those things, measurement, make sure you're on track. But the one that really came through as a differentiator for us was how technology is probably the only way we're going to solve this problem. How the different ways we enable digital technologies, and the two that stood out the most were cloud technologies and AI. Mm-hmm. Now, cloud, we all get, it understands it's net zero. It's got that opportunity to consolidate computing and reduce the carbon footprint. But AI is the interesting one, because with AI, it's both technology for good and potential harm. But the way we look at it is using AI for creating, for example, digital twin technology or biodigital twins, or creating more safer, sustainable cities, or developing more effective supply chain. So when you start to talk about AI and how that technology can solve some of our biggest challenges in the sustainability world, that's where we see our opportunity to contribute. And then to step down into where does health and well-being show up? it shows up as one of the top priorities for technology, for CEOs in focus areas, and how technology will help contribute to health and well-being, not just healthcare, but health and well-being. And I'm sure Heather has some thoughts on that.
Please.
Yeah. Sorry, Ira, were you going to jump in?
No, please go.
Okay, perfect. So I do think never before has it been more important that we retain our nurses, our pharmacists, our physicians, and our employees in our healthcare organizations, right? So healthcare and well-being. And so as we think about taking care of our people and think about our sustainability efforts, I think it's really in line with some of our goals around retaining our talent and ensuring that that talent can contribute in the very best way in our organizations. And so in healthcare today, we are resource poor, right? We are really trying to find those resources that can take good care of patients and ensure we have quality, high quality patient care and the safest care we can provide. And as we do that, I think about these concepts of AI, which is, it turns out that me practicing at the top of my license is my very best experience. And automating some of those other redundant tasks makes my experience a better one and the patient's experience a better one. And so I do think that bringing some of that information into care processes is good, and bringing them into organizations across the globe is good, because we're starting to get care in other places besides in the acute care setting, right? So more and more we are all open to getting our care in places that are more convenient to us. And in thinking about preventative care versus just the treating of the patient, I know in previous podcasts, we've talked about the well-being of our organizations and of our employees, whether that's in the workplace or in colleges or universities, or, where we get care should be most convenient to us, which leads to, better outcomes for our diabetic patients and better outcomes for people with chronic disease. And so those are pieces that also decrease the cost of care. And that's a really important piece of this.
And so, thinking once again about these best practices, three main ones, obviously the organization. Any organization needs to have a vision and make sustainability part of this. Technology needs to be harnessed, and you have to have good partners, because as Vito, you were just mentioning some of these tools, and Heather, you too, the AI, the Internet of Things, the cloud, and then when we get into some of the things we talked about with some of our previous NTT guests, the quantum, the digital twins, we're talking really high-end stuff here, and ability to make impact like we've never had before. Obviously, the publishing of the NTT study, Innovating for a Sustainable Future, jives very nicely with the launch of NTT's Innovation for a Sustainable Future program. And here we have, once again, significant research and development capabilities at NTT, significant digital capabilities. Take us both, once again, please tag team as you want, the parts of this new NTT Innovation for Sustainable Future program, what it's all about, how it's happening, what particular areas excite both of you, based on, once again, your individual lenses of what's going on with the organization, not just for people, but obviously planet as well.
Yeah, so those top three were, really building that foundation, which you talked about. So the study, the Vito's team kind of was really informative to us as an organization. And so sharing that with our partners and with our clients around how they achieve sustainability is one of the things we wanted to be able to do. So it begins, of course, with that foundational piece of strategy, organizational change management, kind of honoring the culture that we're in and ensuring that we're building out that structure that allows for sustainability processes and gets fully embedded. Vito talked about how NTT has done that ourselves. And so we understand that that's a hard thing to do, beginning to push those processes through so that they become part of our everyday work life and part of how we interact with the community, our partners, and others. The second is around innovation and really harnessing that digital innovation to drive sustainability. We've talked a little bit about AI. We've talked a little bit about IoT, and we're thinking also about, cloud and data and how that drives some new and thoughtful processes in our organizations. And the other is, I was talking about population health. And so, as you think about cloud being one of the enablers to bring data in various regions together, and think more carefully about how we do take care of our diabetic patients, how we take care of our patients that develop severe dementia as they age. How do we ensure that their quality of life is really good while decreasing the cost of care that's not contributing to this, better life and this valuable kind of end of life process that happens. And then the third is around partnerships and building those partnerships around common sustainability goals and also standards, right? So we will all benefit from having some standards in these processes. We don't need to rebuild this every time. And so these best practices that come out of the research that this team did are things we want to share. We want to ensure our partners are kind of aware of that process, and then engaging across industries. Healthcare has a lot to learn from other industries. And so we oftentimes are looking outside these days to think carefully about how we, catch up a bit. The study did point out that healthcare is a little bit behind in this area from a sustainability perspective, and really ensuring that we're helping our healthcare partners and leaders do that really well. So Vito, you probably have some great insights in this area.
Well, yeah, I was going to touch on some of the activity and kind of the investments that we're making in innovation. Please. And how it's structured, because again, as I said at the top, we are a large global company that is making huge investments, and these investments have tremendous opportunity to solve many social problems. So in our R&D labs, we spend close to $4 billion a year in investments in primary research. So this is not, short-term, 3 months, 6 months, 12 months. This is 5, 10 years. But what the top level foundational technologies that we're investing in is part of a program called ION. ION is our innovative optical and wireless network technologies. And these technologies have 3 main components that we are sharing with the world, frankly, because we are taking ION out as a not open source, but as a collaborative effort with some very large companies like Intel and Microsoft and SAP. And there's 3 foundational technologies to this research. One is called the all-photonics network. Second is digital twin computing, and third is cognitive foundation. So just to give you a high level, because there's some really deep topic, research papers on this, but all-photonics is basically taking. We all know about photonics networks, an optical fiber, and how that improved our bandwidth and the internet. But this is taking now photonics down to the device level, down to the chip level, to accelerate the speed of the processing and dramatically reduce the environmental footprint by 100 times. Because we know that to solve some of these big problems, we're going to need very fast networks and very fast computing architectures. And we can't do it with the current model because it takes up way too much energy. So this is both a high speed, low latency, and very low energy consuming technology. And like I said, it's being shared with multiple partners to find ways to implement this in devices and endpoints and in computing and so on. So that's the all-photonics network. Digital twin computing, we talked about already, is really taking data and creating a virtual digital twin. And again, that requires a whole bunch of processing, but also a lot of technology to ensure security, to ensure how you can have it in real time. Because if you're going to depend on it, you're going to make sure that it's real time, because you can make a mistake and that could be very expensive and fatal. And the third one is the cognitive foundation, which is a form of AI, but that's really the foundation that connects all of the data, connects all the network sensors and devices. And so all of this works together to create potential solutions, which, down the road, especially as Heather talked about in healthcare, we're going to need multiple components of technologies to solve some of these very big problems. And healthcare is a prime target for that, because in many ways we're we're still operating in an old world of how we deliver healthcare, and we're being limited by technology in many ways. So I think these technologies will hopefully help contribute to that health and well-being target for sustainability.
That's a perfect segue, because several months ago had the folks on talking about from NTT, talking about the Improving the Health of Me white paper, and then obviously the NTT Health and Wellbeing Initiative. Heather, obviously, you have quite broad experience, not just in the health informatics side of things, but human nutrition and so forth. And when we were talking with that team, things like bioprinting and consumer-driven genomics, and really a very long, a fascinating view on the future of what's coming, whether it's augmented and virtual reality in healthcare, whether it's some of the predictive analytics. Talk for a little bit about just what gets you excited in terms of these tools, because they really are a laundry list of the future, and sort of fall into your domain for what healthcare could be and the types of things you write about. What gets you excited? What are you looking forward to on this list? What are some of the big picture themes that you would like to see beyond this list as it pertains to healthcare?
Yeah, great. One of them is around, we've collected a lot of data, and I oftentimes now say we're sort of drowning in data and starving for insights. And so one of the things that we have to do first is put those processes in place to collect data and have digital systems. Some of us loved our paper records, but the truth is they were pretty hard to pull information from. When we found out, for example, that we needed a subset of our patients to be notified about an adverse drug event, for example, right? It's like, oh, going through paper makes that very difficult. Going through data makes that easier. But I don't think today that we're using our data in a way that's really driving prevention of disease. And so now we have these really key insights and the tools and the computing power kind of coming together to do machine learning around cancer, to do, some of the things that we all have thought, why haven't we continued to make progress in some of these areas, and it takes time, but really ensuring we can bring that data together, and not just in the United States or in the Americas, but globally. We're oftentimes restricted in our research and our studies around the data we have access to. And so using data as a service and really thinking differently about how we use data to drive prevention of disease versus treatment of disease is a very important piece. It also allows us to personalize our care. We absolutely know that based on our genetics, we respond differently to certain treatments. And the ability to start to personalize care at the genomic level is, fascinating to many of us. And we have to be really thoughtful about how we go through those processes, use that data really well. But having access to that data and ensuring that it's done in a way that even is thoughtful for access and equity of access for people is very important. Ensuring we have access to those treatments and things like that. And I think those sustainability efforts will go a long ways there. The next that I think we have to think about in healthcare is, for sure, we need to build, renovate, healthcare facilities that are more sustainable. So, we contribute, right, in a big way. And I think if we didn't say that we would be, remiss. So let's start there. But the other is that we do know, and I mentioned this earlier, that the hospital is not where care is going to be provided in the future, right? It's a subset of care processes. And so how do we use all the things that we have access to, our Fitbits and our cell phones and all these things that we're wonderful at using as consumers, to ensure that we're healthier and that we are have a healthier planet in general, and that means ourselves and our next generation. My kids, they're very capable of navigating all of these processes, and they oftentimes do get some really key insights about health and well-being from those processes. And so I look forward to that data driving behavior for many of us.
Yeah, and Heather is the perfect example of the customer, if you will, for the technologies that we're building here. She knows the challenges, she knows how they need to be solved, but all of the technologies aren't there yet, and we need to accelerate that, especially as she said around trust and privacy and security, but speed and and just the innovation of AI. So, when she talks about those needs, our technology people hear that and understand what they need to deliver to help her achieve the results that she needs to achieve for all of us.
And thinking, once again, to one of my original NTT episodes when I spent time with the folks at NTT Research, and once again, Vito, you've talked about some of this so far in terms of the AI and the digital twins and what have you. Obviously, a lot of really bleeding edge stuff happening in the NTT research labs in terms of just physics in general, in terms of cryptography and all these other exciting domains. Anything else in terms of areas of research that you're particularly excited about? And once again, coming from your IT perspective, the last 30 years of really, whether it's today, whether it's 5 years from now, but wow, things that are really going to be changing the paradigm in terms of, you mentioned the photonics before. Anything else you can mention at this point that's not super secretive, but that feeds into this making the planet a healthier place as well?
Well, I mean, my history in technology industry and just being around it for so long has always kind of lulled me into this sense of, well, we have big problems and how are we going to solve them? And I always found that technology tends to become the answer. The worry is that we know technology can help solve some of these problems, but it can also cause huge side effects and problems that we didn't anticipate. So my worry is that ensuring that as we implement AI and as we implement, smarter technology that is going to make decisions for us, we need to understand how this could potentially harm us as well. And one of the things that, even coming from our CEO is understanding how, we need to understand today what the potential for harm is 10, 20, 30, 40 years ago. And the parallel is the Industrial Revolution, which was a huge benefit to us all. It raised incomes, it created, better lifestyles, it improved our health, but it also created this huge climate crisis that we have. And so we didn't stop, 200-300 years ago and say, oh, we shouldn't build these factories because it's going to harm our environment. We just built the factories. And to some degree, we may be doing the same thing now. It's like, well, we're just going to build AI, but we need to also understand that it could be used in ways that we did not anticipate. And how do we manage that? Is it regulation? Is it, built into the technology? How do we put safeguards into the technology so that it doesn't become our next crisis 30, 40 years from now? That's one of the things that worries me in this industry for so long.
Vito, can I jump in and say, I love what you just said, because as I was thinking about mental health, right, which has become, the center of many conversations today around, well-being and mental health, and are really ensuring that we have the ability to connect with our patients, right? So people didn't become physicians to not be able to touch and connect and be empathetic with a human being. And so, how do we use these technologies to ensure that we decrease the workload and the stress level and the mental workload of a provider, all while still ensuring that this connection happens, right? You watch people's mental kind of state of mind affect their health and affect their physical well-being. And so as we say these things, I love this idea that you think very carefully about what is it that we want to maintain, and maintain is a very important part of what we do as humans, and what is it that we can take to the next level that actually makes this faster, easier, more connected.
Yeah, I mean, the technologies that we introduce, like, again, we don't know the effects. The social media is another example, right? Where it was all good and we all signed up and we all thought it was great. And then we realized, oh, wow, this thing is creating divisiveness and it's creating, mental health issues. And so we just think about that. We think about that as NTT. We think about, let's make sure we design this technology with that in mind, and ensuring whenever we do take something to market, we understand how it can be used and not abused, I guess is the best way to put it. So that's my concern right now with technology and where it's going.
Got it. I'm gonna, Heather, I'm gonna come with you first with this, and then Vito, I'll give you another version of this one. But as I mentioned in the bio, aside from Heather, everything you do at NTT, you also still lecture at University of Colorado, and you're actively involved in mentoring. Could you say a few words about how, obviously now the sustainability message is there amongst the technology and everything else that you're involved in, and bringing the sustainability message to whether it's your next generation of doctoral students or the generation before that that's coming into the workforce for the first time. Talk a little bit about how you, in your mentorship, whether it's your mentors, your students, and so forth, you integrate the sustainability message, if you would.
Yeah, it is an area where we are pretty thoughtful, especially in academia, about how we mentor. There are very formal processes. But I think some of this happens in a little bit more of an informal process. And I've always found that having one foot in academia and one in industry has been a really balancing process for me. It forces me to think about business and what drivers there are there. And it also allows me to watch what's going on in healthcare and kind of know what those pieces look like and to be there physically and see what it's like. And so as I am talking to our doctoral students, oftentimes providing examples and showing them how organizations are making decisions, we bring a lot of these real world examples into the classroom. So we've all been in that classroom where it was very academic and sort of, textbook driven.
Right.
And what most of us really benefit from is the story of how life sciences organizations are doing this, of how NTT is doing this work, right? And folding that into, it's really hard. And I oftentimes say this to our students is, it sounds easy to talk about organizational change management and communicating with people and, being strategic. And then when you start giving them the example of how a leadership team walks down that road and gets lost, right? And oftentimes has some things happen that are really challenging, the light bulb goes on and they go, I get how complex it is now. And then often I think our doctoral students and our medical students use their network that they build in those programs to kind of say, like, I'm now doing this in my job. Remind me what you said and what we said. And so we start to really embed those processes in our actual work life. So I think learning is changing, which isn't that wonderful because memorizing is not valuable, but experiencing these processes and allowing others to learn from the things that we didn't do great as we did them is a really important part of that process.
And Vito, same question to you. Obviously, you're involved in other stuff besides NTT in terms of the Information Technology Association, working with United Way and so forth. Say a couple words, if you would, about how you bring the broader message of sustainability out into the broader community, if you would.
So we, I also have a small role with advising some startups as well in the Waterloo area, and I think that the innovation that's coming out of these companies and how they're using it to contribute to society. I have young kids, well, not young kids, older adult kids, and they have the same view is that, what are companies doing to contribute back to society? They're making choices and selections based on how they perceive companies contributing. And so my advice to, whether it's a startup or any other business associates is, you need to make that kind of a main line of your strategy, because it's not just words on a website that you hear that people are making decisions based on this. It truly is something that is driving behavior, driving the Great Resign, driving all of these changes in our society. So my role, once I'm got a few minutes left over from everything else I'm doing, is to just try and communicate these messages to the people that I engage with on a regular basis, and hopefully that message spreads.
And Vito, don't you find that this next generation is almost leading that conversation, right? I mean, they're asking organizations in an interview what they're doing in these areas of well-being, of health and well-being, of mental health, of sustainability, of, they're their view often of sustainability, which is, as we talked about, a very broad topic and covers a lot of areas. But, I find people ask us those questions, and I think it's great to see them prioritizing and thinking that that's an important part of, how they contribute to the world.
Yeah, I think they have a level of, I don't know if it's security or a level of confidence that I don't ever remember having. I was going through interviews. I would never ask the interviewer
They have
any
a few
questions.
more options, don't they? I think than when I started working. So
I guess they feel like they do. I'm sure we did as well. We just didn't have that kind of sense maybe from our previous generation. It was more like, no, you just got to get a job, whatever the job is, just get the job. Whereas now they don't feel that way, and I give them credit for that. I think they'll live healthier and happier lives if they look at the world that way.
Outstanding. Yeah, it's a fascinating set of initiatives. You both have a lot on your plates, but I'm really rooting you on with this because it is clearly a big piece of our story, of our integrated story. Not just obviously we want to make money, but we have to keep the health and well-being of the people on the planet, as NTC says, in order. So it's very exciting for everybody that is going to be listening to this particular episode on the various podcast networks or watching on the YouTube channel. You've been listening to both Vito Mabrucco, Head of Global Marketing at NTT, also Dr. Heather Haugen, Vice President of Healthcare Advisory Innovation for Americas at NTT. Said doing very important jobs in contributing to the health and well-being of both people and the planet that we live on. Heather, Vito, I want to thank you both for taking the time out of your schedule for coming on the show today and talking for a little while about these important topics. Obviously, thank you for everything you're doing and continue to do there at NTT. And as we like to say on this show, thanks for helping to create a better tomorrow for all of us through what you're doing. It's a really fascinating story.
Thank you so much, Art.
Sharing it.
My pleasure.
Great having both of you.